This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google Ivy Panda Free Essays.
Introduction. Nursing requires a high level of professionalism and exceptional attention to patients' needs. The development of nursing has led to the creation of specific rules and standards that regulate the modern healthcare system. Workers in the field of nursing have a significant impact on public health, whether they work in caring, educating, or managing positions. For purposes of setting professional standards for nurses and protecting public interests, the Nursing and Midwifery Council, NMC, Code was created. The professions regulated by the Code have various skills, knowledge, and responsibility. However, they all practice ethics outlined in the NMC Code and are accountable for their work based on the key provisions of the Code. Only nurses, midwives, and nursing associates who follow the Code and meet its requirements are allowed to work in the United Kingdom. This paper will critically analyze the Nursing and Midwifery Council Code of Professional Conduct and how it acts to promote professional values and guide professional nursing practice and care for patients. Defining the NMC Code. Before exploring the NMC Code and its impact on the quality of care provided to patients, it is imperative first to define it. The Nursing and Midwifery Council is regulatory for midwifery and nursing professionals in the United Kingdom. It keeps a register of all the nurses, midwives, and nursing associates and sets standards for their education, training, performance, and conduct. NMC also deals with cases when these standards are neglected or not met. The Nursing and Midwifery Council developed the Code to present a framework of professional standards that nurses, midwives, and nursing associates must follow to be registered to practice in the United Kingdom. The Code emphasizes four main themes: prioritize people, practice effectively, preserve safety, and promote professionalism and trust. The value of the Code. The provision of prioritizing people explains that nurses and midwives need to retain people's dignity and treat them as individuals, be attentive to people's preferences and concerns, respond to their physical, psychological, and social needs, respect their rights to privacy and confidentiality, and always act in the best interest of people. The second provision, practice effectively, requires practitioners to act by the best available evidence, work cooperatively, communicate, maintain accurate records relevant to their practice, share their experience, knowledge, and skills where appropriate, and improve their professional practice according to the received feedback. The third part of the conduct, preserve safety, states that the nurse or midwife must recognize and work within the limits of their competence and practice the duty of candor. It also obligates a nurse or a midwife to immediately raise concern whenever the public or patient's safety is at risk and take specific actions to deal with matters when it is appropriate. The fourth part is based on promoting professionalism and trust by maintaining the reputation of one's profession and position, presenting personal commitment to the Code, and remaining a figure of leadership and integrity. The Code allows for the professional growth of healthcare practitioners based on the patient's needs and feedback. The fifth component, promote professionalism and trust, is developed to ensure that nurses uphold a high standard of reputation and professionalism at all times. The professionals are expected to exhibit a personal commitment to the standards of behavior and practice that have been outlined by the Code. This means that each nurse should act as a role model for integrity when providing care to patients regardless of their cultural background, race, gender, ethnicity, education, or socioeconomic status. Thus, the general tone of the NMC Code is ensuring that professionals operating in the sphere of nursing and midwifery show as much respect and compassion to the needs of patients to foster a positive environment in which the care requirements are met. The NMC Code is essential for promoting professional values and guiding professional nursing practice as applied to the United Kingdom healthcare context. As mentioned by Fitzpatrick, the Code underlines the importance of communication as a professional value that encourages upholding and protecting patient care. As nurses spend a lot of time with their patients, they are expected to develop trusting relationships with them and facilitated rapport. Such relationships are imperative because they offer practitioners an opportunity to evaluate the health of their clients in terms of both emotional and physical well-being. Throughout the NMC Code of Conduct, it is stated that nurses are expected to communicate effectively not only to benefit patients but also to work in teams. Because of this, every standard, prioritizing people, practicing effectively, preserving safety, the duty of candor, and promoting professionalism and trust, implies a certain degree of communication. The professional values of nurses are reinforced and supported with the help of communication, which helps to facilitate honesty, transparency, and the fostering of environments that encourage high-quality care. As related to professional values, the NMC Code influences the facilitation of positive attitudes within the process of care. Newly qualified nurses that only begin their work should reflect on their values and standards and their influence on practice. Thus, it is expected that nurses who have a genuine desire to help people will be more likely to possess such integral qualities as respect, honesty, and responsibility. Concluding remarks. In conclusion, it should be mentioned that the NMC Code makes a connection between the personal values of nursing practitioners and their professional duties as identified in the Code. Professionals should be compassionate and respectful of patients for whom they care to improve their health as well as life in general. The best way to provide care for patients is to facilitate care, commitment, compassion, competence, and communication. The combination of these principles encourages professionals to be dedicated to their work and use evidence-based care in conjunction with principles of respect and positive attitudes to the process. If you want to find more works like this essay on Nursing and Midwifery Council Code, head over to ivypanda.com. It has a collection of free samples with thousands of submissions covering virtually all academic subjects. No registration required to access it.